Unit 104 responds to 25-year-old male complaining of shortness of breath.
BSI, is my scene safe?
Scene is safe.
All right. What's the number of patients?
One patient.
One patient. My general impression of the patient is that he is in the tripod position with what seems to be labored breathing. What was the mechanism of injury and or nature of illness?
Shortness of breath.
Shortness of breath. Thank you. Hi, sir. My name is Neil. I'm an EMT, and this is my partner, Angie. She's also an EMT. What seems to be going on today?
I can't breathe, short of breath.
The patient is speaking to me. This shows me that his airway is patent since he is speaking to me, and his ventilations are inadequate due to the chief complaint, which is shortness of breath. So now I'm going to assess his circulation. He does not seem to have any major bleeding. I am also going to check his pulse. Does he have a pulse?
Yes, he does.
And what is that pulse?
80.
Thank you. I'm also going to check his skin signs. What are his skin signs?
Pink, warm, and dry.
Okay, thank you. Now I'm going to assess whether or not we need additional backup. We do not. I'm also going to consider C-spine. We do not need C-spine. So now I'm going to ask my partner Angie here if she would please hook up him to oxygen at 15 liters a minute via non-rebreather mask. Could you please do that, Angie?
Got it.
Thank you very much. Now, while she is getting that ready, I'm going to collect my OPQRST. Sir, what seems to have happened today? How did this all come about?
About an hour ago, I couldn't breathe. I lost breath.
What were you doing?
I was just walking outside.
Walking. Okay. And you say that the walking also provoked it.
Yeah.
Okay. So now, if you could use a word or a couple of words to describe how that feeling in your chest and or lungs feels, what would it be?
It's just tight. It's tightness.
Tightness. And does it radiate anywhere, or does it stay the same, in the same place?
It just stays in my chest.
Just stays in your chest. All right. And on a scale of 1 to 10, 1 being no pain at all, 10 being the worst pain you've ever felt in your life, what would you rate this pain?
About a 6.
About a 6. And once again, you said, when did this start?
About an hour ago.
About an hour ago. All right, thank you. Now I'm going to obtain a sample history from the patient. Sir, are you on any sort of medications?
I take an inhaler.
An inhaler. Wow, I think I know the next answer to this next question. Are there any sort of past medical history that we should know about?
I have asthma.
Asthma. When was the last time that you ate or drank anything, sir?
This is water. The only thing I had this morning.
Okay, and about how long ago would you say that was?
About 5 hours ago.
About 5 hours ago. Do you have any allergies to anything, sir?
I do not.
No allergies. All right.
None.
So now we have the patient hooked up to oxygen, and I'm going to ask my partner Angie if she would please take the vitals while I auscultate lung sounds.
Yes.
Thank you. What are his lung sounds?
Wheezing bilaterally.
Wheezing bilaterally. And his blood pressure?
Blood pressure is 128/68.
All right. His pulse?
His pulse is 80.
Okay. His respiration rate and quality?
Respiration rate is 38 labored.
38 labored. Okay. And he seems alert and conscious?
Yes.
Okay. Thank you very much. So we are going to, so my general field impression of this patient is that he is having an asthma attack due to the labored breathing, the fast respiration rate, and the wheezing lung sounds bilaterally. So what I'm going to say is what should be the treatment is that we will assist him with his inhaler. So, and we are also going to transport him to the hospital at this time. Now, I'm going to repeat the primary assessment. I'm going to repeat the vital signs. How are his vital signs now? How are his vital signs now?
The vital signs are normal.
Are normal, within normal limits. Thank you. And did the treatment appear to work?
It did work.
Okay. And last but not least, I'm going to repeat the secondary assessment. And scene.